Why is misdiagnosis such an issue?
Misdiagnosis of vascular anomalies is quite common. Uh, there's a historical part and a clinical part. History-wise, most of these malformations were called by common names, despite the many different types of vascular anomalies and malformations and tumors. Uh, they were referred to as angiomas or hemangiomas or some other tumor names, and most of those are imprecise or completely incorrect. Clinically, these malformations can look alike, and this can create a lot of confusion for clinicians who don't see these malformations on a daily basis. Some of these syndromes are quite rare, and for clinicians who are not familiar with them, they certainly will opt to diagnose them under a larger category, which is likely to be incorrect. With the improvement of the genetic and imaging testing, now we're familiar with different types of syndromes that may look alike or they may have similar presentations, but they're completely different, which means that the management could be actually different, the effect on the family, the ramification for the long-term prognosis is different, and the way these patients should be handled and the type of interventions they may require can be actually completely different. As you can imagine, with giving the patient the wrong diagnosis based on the history and the clinical aspects given to the patient, the incorrect or improper treatment can be given to these patients. So the wrong diagnosis often brings with it some trials of treatments that should not be dispensed to these patients.